Bloodletting is not only a safe and very practical technique and simple technique, it could be also the next breakthrough in your clinical practice. In this video, we will present what is bloodletting and we'll also show you how to conduct bloodletting therapy. Bloodletting has been used in many traditional medicines for centuries, including China, the Arab world, and Europe. Although its use in Europe decreased in the 19th century, its efficacy was never formally disproven by clinical research. Quite the opposite. Clinical trials conducted recently in China show that bloodletting can be safe and effective if conducted appropriately. The key here is to use correct instruments and procedures, appropriate bloodletting locations, and quantity of blood. Generally, we use a 3-edged needle, diabetic lancets, hypodermic needles to prick the skin. Normal needles are not thick enough to produce bleeding. We generally conduct bloodletting on capillaries, which means pricking the skin as capillaries are invisible. Capillaries bloodletting is conducted on the ear, Zhaoyang point, back shoe point, or fingers and toes. It is also possible to prick veins. This is generally conducted on small congestive veins on the legs. The functions of bloodletting are mainly to move blood stasis and release pathogens such as heat and dampness. It can be used for a large range of conditions, including pain conditions, acute inflammation, skin conditions, neurological diseases, psychological conditions, and circulatory system conditions. We are now going to see how to conduct bloodletting therapy. We are now going to show you the capillaries bloodletting. So when we are doing capillaries bloodletting, we want to prick directly on the skin. So there is no need to have visible vessels, we just prick directly on the skin. Today we're going to do it in the ear apex. And the ear apex is a very good point to remove all the pathogens from the upper jaw, so it could be heat or even wind. So all these pathogens can be removed and to move thin blood in the upper jaw as well. So we need, again, to have the patient ready in a comfortable position. You need to have all your equipment at hand, so including the diabetic lancet we are going to use today, the alcohol swabs, you have dry cottons to wipe the bloods, and of course you have your gloves on, which is very important when doing bloodletting. Also we have our sharp container, which is very close, so we can directly remove the bloodletting equipment after we finish to do the bloodletting. As you can see, our patient has long hair, so I will, Samantha, can I just ask you to use your hand and just put your hand over there so you can have your hair removed from this area. Can you do it again? Just make sure you have all the hair. Yep, there's a bit more here. Awesome, very good. So do you want to try to have your hand slightly above? Yep, so excellent. So now the area is cleared and I don't have hair on the way. I'm going to disinfect the area with the alcohol swab. So you can really make sure you have all the area covered. Yes, excellent. That's good. And I get ready with my diabetic lancet. So I'm going to prick quickly. So Samantha, I'm going to prick in the skin. It might be a bit painful, but it will be very quick. Are you okay?
Okay.
Can we start?
Yeah.
Okay. All right. So I discard it directly, and I'm going to press. So you can see the blood is coming out now. It's not a lot, but it's enough. And we're going to use our cotton swab to wipe the blood out. So the color of the blood will have some meaning. When the blood is very dark, it could be a sign of stagnation, so it's usually either blood stasis or some coldness. When the color of the blood is very intense red, this could be a sign of heat and when the blood is relatively light. So this could be actually thin blood deficiency. So in this case, we generally don't want to do bloodletting. So you can see here that the blood is coming out, but it's not very dark. So there is no point of doing it for a long time. If the blood coming out is going very dark, I can keep doing it again and again until it starts to be harder to draw it out, and also the color of the blood is getting lighter. But because today the blood is not very dark, I'm just going to do it for 3-4 times, and we're going to call it a day. So I just make sure I remove all the blood, and I'm going to use again one of our alcohol swabs, and I disinfect the skin around the area. Here we go. We are now going to do the vein bloodletting. So vein bloodletting is instead of pricking directly the skin as we were doing with the capillaries bleeding, we will find some veins and prick directly the vein. Before you start, as with other techniques, you need to make sure your patient is comfortable and ready. You'll have your equipment also available around. So we have our hypodermic needle here, we have some alcohol swabs to disinfect. I have my gloves on, and we have some cotton for the blood, and also some paper towels just in case. When we are doing vein bloodletting, so now I'm going to do it on the bladder and gallbladder channels area. This is really good for lower back pain and even neck pain, to move the thin blood in the whole channel. So generally what we want to do is find the veins that are very small and dark, like these zigzag veins over there. You see that they're very dark. So you want to prick this kind of veins. The large, big and deep veins that are a bit faint like this, you don't want to needle these ones because there is a risk of bruising. So you see these ones are very deep, and you don't want to prick these ones. So we're going to do it here today. Okay? I will put some paper towels just in case the blood is coming down. Here we are. And I will disinfect the area with my alcohol swab. So I want to make sure I disinfect the whole area. Okay, so now we are ready. Samantha, I'm going to start to prick the vessels on your legs now. It might be a bit painful, but that will be very quick. Are you ready? Okay. So I will do it right here. So you can see that generally the blood will come out directly. There is no need to press or to put a cup or anything. And you remove directly, discard directly the needle once you're done, and you can use a cotton ball just to wipe the blood, so it will come a bit more freely. So you can see this blood is relatively dark. It's normal, it's exactly the blood we want to get out. And after a while, it will start to be clearer and clearer. So it means the circulation is getting better. There is less stagnation. Yep. So you can see that the blood flow is going to be not as smooth at the beginning. It's good. And also the blood is starting to be a bit clearer. It's not as dark as it used to be. So this is also a sign that the stagnation is improved. Yep. So when you see that now the blood is almost not coming out, it closed naturally. You can just press a little bit to make sure that the hole is closed. Alright. And I can do it in 3 or 4 different locations during the same session. And just at the end, remember to wipe the blood away with your alcohol swab. Okay, here we go. We are now going to do wet cupping, which is actually the combination of bloodletting and cupping. So in order to do that, again, as usual, we need to have our patient ready in a comfortable position. The area has to be uncovered, especially for the hair, so you have to make sure the hair are not on the way. You will have to wear gloves because we are going to do bloodletting. Your equipment is ready, so we have here hypodermic needle, we have our alcohol swab to disinfect the area, and we have our cupping material over there. We also need to have the sharp container not far away because we need to discard the material directly. So I'm not going to disinfect the area. We are going to do GV14, which is a very common area to remove the heat from the body. I'm going to prick the skin with this needle 5 to 7 times, and then directly after that I have to use the cups to make the pressure, to create the pressure so the blood will come out. This has to be very quick because the holes created with the needle will close very quickly. So I need to be quick for these procedures. All right. So Samantha, are you ready now? I'm going to start to prick the needle. It might be a bit painful, but it won't be quick. Okay. So I can press a little bit the skin this way, so this can improve the blood flow in the region. I can press also a little bit, and I'm going to prick now. Okay, that's very good. Now I need directly to discard it in the sharp container, and I need to be very quick in taking the cups and creating the pressure. So is it too tight or is it bearable?
Bearable.
It's bearable. Okay, that's good. So you can see that the blood is coming out very smoothly with the cup because of the depression created by the cupping. Generally, we'll keep the cups for 5 to 10 minutes. So now it's been 5 minutes and we want to remove the cup. So when we want to remove the cup, we'll have to be careful about the blood. We don't want the blood to spread all over the place. Generally, if there is a very small quantity of blood, what we are going to do is we just remove the cup and then we wipe it with our paper towel. Because there is a bit more today, what I'm going to do is I'm going to take my paper towel and I will place it. Actually, I will push the cup on one side, so I want to collect the blood in the cup directly. And I'm going to put here the paper towel in just in case there is some blood dripping. and I'm going to push the blood from this side, so I'm sure it's going to get inside the cup, if that makes sense. Okay? Are you ready, Samantha? I'm going to remove the cup.
Okay.
So, put the blood inside, and just make sure you can just wipe the rest of the blood here. Okay, and then I have another one. We'll have to discard this cup. According to Australian regulation, it's not possible to reuse a cup when we have done wet cupping. There are a few precautions you need to take when you are conducting bloodletting therapy. So first you have to be careful about blood stains, because you don't want to have blood stains on the clothes of the patient, on the massage table, or on the hair of the patient. So make sure the area is fully exposed and there is no hair around, there is no clothes around, and you can also use paper towel if you think the blood might drop down, to protect the massage table or to protect the clothes of the patient. Second, there is a risk of fainting that is higher than in normal acupuncture. So make sure the patient is in a secure position and will not fall down during the bloodletting therapy. Third, you will have to be very careful about vulnerable populations, such as poorly controlled diabetes patients, older adults, or patients who are taking anticoagulant medications, people who have bleeding disorders, and also be careful with pregnant women and people who have a weak constitution. I hope you enjoyed this video. My name is Yoann Birling, clinician, lecturer and researcher. This video was produced by Sydney Institute of Traditional Chinese Medicine. Please check our tutorials and more information on the school in the description below. You can join our community and also give this video a thumbs up if you liked it. Good practice and take care.